It says live.
Okay, and we are live.
Good evening.
Hi, this is Dr. Tamia Austin, and I'm joined by the awesome and beautiful and all that Dr. Maisha Pesante. We just wanted to jump on really quick tonight just to tell you about this great thing that we are planning for you. We have been working on this for months, well, weeks. And it is called Sickle Cell Trait 360 Full Spectrum Education. So, Dr. Pesante, what do we mean? And let's not give it all away. We're just teasing the people because we want them to come and register. So I'm going to put the link in the chat for people to see, and we'll also list it in the comments for people to go ahead and register. But what are we talking about when we say SCT 360 full spectrum education?
We are talking about education that finally acknowledges the spectrum of sickle cell. We're not going to call it just disease or just trait or anemia. We're saying there's a full spectrum here, and there's a range everywhere in between. It's not just this or that. We're getting out of the binary thinking of just either it's sickle cell disease or it's sickle cell trait, and we're looking at what is really going on all the way around the clock in terms of what can be going on with different types of sickle hemoglobinopathies.
Different types of sickle hemoglobinopathy. So what we want, this has been designed for practitioners of all specialties, all levels, and even public health workers that have their chest and MCHES. They can get 5 units for $53 Thursday.
That's a giveaway.
That's a giveaway. And and if we were positioned to just give it away, that's exactly what we would do, because it's that many people. It's 4 million people along this spectrum in the United States and 300 million, around the world. So join us, click that link, register. It's free of charge for community members. You want to learn about sickle cell. And the great thing about Dr. Maisha, MD, is that this is structured for the medical appetite, the clinical appetite.
This is structured for the clinical appetite. Yes. Yeah. We are very proud of this. This is structured for doctors, nurses, physician assistants, nurse practitioners, anybody who's doing anything in health, all the way up the chain. Everyone will benefit from this. You can get continuing medical education credits as well, which medical education credits, typically, if you can get those, you can get the rest.
Yeah.
So we are targeting MDs specifically and nurse practitioners and PAs specifically, because we want the front line, especially primary care people who are going to meet the sickle cell trait patient who was not necessarily found or referred as a child to hematology, but is having tons of symptoms that fit sickle cell hemoglobinopathy, the sickle cell hemoglobinopathy picture. We want to have a transformation and a re-education about what is and what is not sickle cell trait and sickle cell, how it presents, what it looks like, what is the duck here? How's it quacking? What's going on? What are people experiencing? What is the literature saying? What are the changes in the past 3 decades? We had a certain mentality about it that led to certain outcomes. What outcomes do we want to have different now? And so we want everyone to come. How do you take care of your patient that is telling you, yes, doctor, I know you tell me I just have trait, but I'm telling you I'm sick. I can't do anything. I'm not functioning. I'm sick just like my relatives who have sickle cell. Maybe not as bad, but I'm still having the same thing. So what do you do, doctor? How do you take care of that patient? Is your patient just making it up? Is it all in their head? Are they just seeking narcotics? What are your options here? One of the great things about this conference, there will be some herbal people there as well, who can tell you some natural ways to take care of yourself if you don't want to do pharmaceuticals. Most people don't want to do pharmaceuticals. So I think everybody needs to come and learn and find out. We don't have to say one or the other. Either it's totally silent or it's completely deadly. We can look at all the ranges of what people are going through and find a middle ground for how to take care of this. We don't have to give up our lives. We don't have to give up our sports just because we say sickle cell trait might make you sick. No more than asthma making you sick means you have to give up your sport. You just have to take care of the patient.
You just have to listen to the patient. And that's kind of what my life's mantra is. I listen to the people. And as you said, if it walks like a duck, it quacks like a duck, then it might be a duck. I had an earlier live, and the question came, how, I need something to take to my doctor. And one of the things that's actually quoted on our event flyer is, I want my doctor to come to this because I want them to learn about me. And that really touches the realness of what we have to offer. Is there still time? This takes place Thursday from 10 to 4:30 p.m. Eastern Standard Time. Registration is only $53. You can and just click the link in the comments and you can register and tell your provider to come. Tell your nurse and clinician to come and get this information so that they can learn about you. That's exactly where we're trying to meet you, right there. And
yes,
I feel like that's the message for tonight.
Yes,
we're going to tease you and invite you to join us, get this these 5 hours, these units, CMEs, and as Dr. Pesante said, if you can get CMEs, then all the rest, follow.
Yes.
And we'll see you on Thursday.
Yes, we should answer a lot of the questions you have had raging in your mind and give you some information that you can actually use for yourself as, healthcare professionals, or for yourself as a community member. And that's our goal.
And that's our goal. You don't have to dress up. You can log in from your computer at home. We'll see you at 10 a.m. You get a lunch break, and we'll be done by 4:30, if not before, and you'll be armed with 5 more hours and way more value added for the information that you'll get. So we'll see you Thursday.
Can't wait.
Thank you, Dr. Pesante.
Thank you. And Dr. Tamia, we are so happy that, we've partnered with you to put this on. You've done so much great work. And I pray the community realizes how great you are and how blessed we are to have you and your skills and your work with the As One Foundation. So people can also get more information about us on Inscription's website and What's the Count. I do sit on their board, and Inscription is the new company we've started. We are doing consultations for people with trait, just for educational purposes, for that one-on-one. If people want a more personal, I want them to know that they can look for me and they can book an appointment after Thursday. No appointments before Thursday.
Thank you so much for mentioning that. We have a great team, including What's the Count, Inscription, and the Chris Johnson Foundation, yes, all coming at sickle cell trait from all of the angles needed. This is full spectrum education. And, yes, we're here for the people. We're going nowhere but up together.
That's right.
And so we will see you Thursday. Thank you so much, Dr. Pesante. Click the link and join us.
All right. Good night.